Hello everyone. Welcome to online session of Healthcare Awareness Society of Australia. We are talking today about COVID, its impact on children, and how to prevent it, particularly children to go into the stage of needing hospitalization, and talking a bit about vaccination. As we all know, New South Wales is few weeks ahead of Victoria, and that's why I have invited a panel of experts from New South Wales so that we can learn from their experiences. So first of all, I'd like to introduce our expert panel, Dr. Habib Bhurawala, who is a pediatrician and head of pediatric at Nepean Hospital in New South Wales. Welcome, Dr. Habib.
Thank you.
Good. So next is Dr. Kalpesh Jain, who is a pediatrician at Auburn District Hospital in New South Wales, and he is a trained pediatrician and neonatologist both. Welcome, Dr. Kalpesh.
Thank you.
And next is our expert panel, Dr. Lenina. She's a pediatrician in Canterbury Hospital and a great academician. Welcome, Dr. Lenina.
Hello, everyone. Nice to be with you all.
Thank you. So next is Dr. Ansar, who's a pediatrician at Wollongong Hospital, again pediatrician and neonatologist, double trained with a lot of experience in general pediatric and neonatology. Welcome, Dr. Ansar.
Hello. Hi. Thank you.
Right. So look, I would like to ask, like when the COVID started last year, and we are in COVID for last 18 months. And in the last year, we were more worried about vulnerable people, elderly people, more than 60, 70. And when the Delta virus has came and it has changed the world upside down. And now we started worrying more about the younger people, the young adults, and the pendulum is more shifting towards now to our children. And I would like to know from your experience, Dr. Habib, what do you think? Is it really the pendulum is swinging towards children now? Are they getting more likely to be infected with this Delta virus?
Yes, certainly. That's what we've seen also in New South Wales, and the experience internationally suggests to us that when the majority of the adult population gets vaccinated, the infection it's start to trend toward the younger population and also towards children. Just in last 3 months, data suggests in New South Wales that up to 20% of total infections, and in some cases up to 30%, have been children. So under the age of 20 years of age, have been up to 30% of total caseload. What we're also saying is because the Delta is more transmissible compared to the previous strains, whole family is getting affected, 100%. So if the adult is getting infection, the children are getting infection as well. So we have certainly seen more and more children are being infected. And we also have to bear in mind that there is no vaccine for children under the age of 12 years of age as well. So that's the population still, in a way unprotected from COVID infection because there is no vaccine.
So you use a very right word, Dr. Habib, that it is more transmissible. Does it mean that it is more serious infection also? Does it more likely to cause severe illness in children? What do you think, Dr. Kalpesh? Dr. Kalpesh, is it likely to cause more serious illness in children?
Yeah, so what we have seen so far is that most of the children would normally have milder form of the illness. However, given the fact that the Delta virus itself is very transmissible, more contagious and more infectious, we have seen children with more severe illness, what we call it as multi-system inflammatory syndrome in children, which is basically affecting all the organs of the body. And these children, they present with significantly sick, in the emergency department, they would normally be having significant breathing issues. The blood pressures would be low, and these are the children who would definitely need intensive care admissions. And of course, once they are admitted in the intensive care, it's a group of intensivist and hematologist, infectious disease people who would then work on the child and need help to make sure that the child is well and healthy and come out of the intensive care well. But it is well documented that the children can get significant severe illness because of the Delta variant.
I mean, that's really a worrying thing that children can get a severe illness, particularly which you mentioned about the multicystic inflammatory syndrome, particularly in childhood. And but let's talk about more. What are the commonly these children present? And because as a parent, I would be very worried about if my child is positive with COVID, and how I need to manage my child, whether it is at home, what time I need to think about bringing the child to the hospital, or should I ring the emergency? Dr. Habib, would you like to tell me a little bit more about when the parent should start worry about these the symptoms, and they should bring the child to emergency or call the ambulance?
Majority of the children remain well, which is good in COVID, and the information so far suggests to us that many of those children may be asymptomatic. They may not even have any symptoms, and the numbers might be between 20 to 40% may not have any symptoms, which is good. The rest of those who do have symptoms, they're generally the symptoms what you will also see in other viral illnesses such as cough and fever. They are quite common, runny nose, and also they can have diarrhea and vomiting. And that's what we've seen with the Delta, especially this year in Australia, that they also present with diarrhea and vomiting. When we should worry, I think if the fever is high, not improving, and the child is not eating well, looking not well, not making eye contact, or not really responding, not within itself, these are the signs when we should be worrying and we should be getting some medical help and advice. If they are you try in all of these cases, as in other viral conditions, you would try with simple analgesia medication at home, such as paracetamol, and then they generally get better. If they don't, I think that's another warning signs and red flag. The signs we worry the most is if they have chest pain, if they feel short of breath, if they're saying their heart is racing fast, or if they're fainting. These are the warning signs, and that's when you get urgent medical attention. So either you get help, whatever is quickly available, get an ambulance, call 000, or talk to your GP, whatever is quickest for you to do.
Yeah, that's as you said, the majority of the children, they are still having either very mild symptoms or no symptoms. Like in general, around 98% of the children, we are lucky in that way, they are not severely infected. But is there any set group of children, those who are more at risk of catching infection or ending up in hospital? And what do you think in your experience, Dr. Ansar?
So yeah, as Habib said, as you all said, most are mild, but there are certain children with some chronic underlying condition, some rare children with type 1 diabetes, some younger children, it says in the statistics, under 3 months can get severe infection. But in general, so far we are not seeing that commonly. Most of them is not needing to come to hospital, but especially children with a chronic illness, children with diabetes, and like adults, quite significant overweight or obesity is considered as a risk factor for having a severe illness, especially even in children too.
Yeah, I think this is what, for as a general public, or as a parent, we need to understand that COVID infection can happen in children. Majority of the time, this infection is very mild or they remain asymptomatic. It does not cause significant impact, but definitely certain group of children, they are at a quite high risk, particularly as mentioned by Dr. Ansar, children with diabetes, children with prematurity, children those who are underlying chronic lung disease, particularly cystic fibrosis, chronic bronchial asthma, children with myopathy, cerebral palsy, Down syndrome, those who are immunocompromised children on steroid, congenital heart disease, or chronic illness, they are quite significantly at risk to end up in hospital. And I think the other group of children, those who are more likely to end up hospital, are the adolescent. In all of the pediatric age group where we see the COVID can impact or cause the severe illness, majority of them, the severe illness is seen in adolescent group without any, even with or without underlying risk factor. So, Dr. Kalpesh, would you like to tell me a little bit more about if 98% are having a mild illness, what is generally the recovery time, or what are the chances of them having recovered fully, or is there a likelihood they have likely to have any long-term consequences or long-term illness or sequelae there?
So Raj, I guess most of the time we have very mild illness. Most of the children would recover in a span of 5 to 7 days. There is no, at this point of time, there are some reports which have been described, what we call it as a long COVID syndrome or a post-COVID syndrome, which is well described in adults. The long COVID syndrome or the post-COVID syndrome, what we know of is the signs and symptoms which are similar to the COVID infection and which are persisting for 12 weeks beyond the infection time. And this is called as long COVID syndrome. There have been reports from UK that children have had the long COVID syndrome or post-COVID syndrome. So the symptoms extending up to 12 weeks after they've had the infection.
Yeah, and is there, in your experience in New South Wales or in overseas, and have any mortality or death in children? And is there any particular risk group? Those are more likely to end up in intensive care or likely to die?
So far, what I've read and what I know here in New South Wales, we haven't had any cases of mortality. But I would possibly ask Dr. Bhurawala whether if there is any more reports around this. Yeah.
Dr. Habib, would you like to add in that something?
Sure. Look, I think, yes, we've not heard of any deaths so far, but we do know that there have been children who needed intensive care, and there's certainly children's been admitted in New South Wales as well. And may I just, as you, I think, pointed out, I might just summarize the group which are most at risk. And I think the parents who might be listening to this should consider, for those are the groups where there is a more risk. So adolescent in general, and also we know that infants under the age of 3 months are most at risk of getting severe illness. And if you look at the chronic conditions, some of the data, especially from overseas studies, suggest that those who have type 1 diabetes, the children who have type 1 diabetes, they have a 4 to 5 times more risk of getting hospitalization and getting more severe illness. The other group is obesity. So children who are obese or overweight, between 2 to 3 times increased risk compared to other children of the same age. And children who have cerebral palsy, they have chronic conditions, autoimmune conditions, they are on some chronic therapies. This is another group where is shown to have increased risk. So these are also the group which are also being put on a priority list for vaccination as well by the government. And these are the group we recommend that they should get their children vaccinated because there is more risk. So some information from, especially from America, suggests that of the overall total children who died, more than half of those who had chronic medical conditions. So COVID actually gets there, I think it's more severe in that group that group is more likely to hospitalize, and some of those children most likely to die. The last data suggested around 460 children died in America. That's in couple, like a lot of cases. I think 650,000 cases in children in America total. So it's very small numbers, but still it's a significant number, and out of those, almost half of those children didn't have any underlying health condition, and still they died. So we're lucky, I think, in Australia. The good thing is also that we have vaccination rates are going up, especially in New South Wales, and that is also helping. And that's another message I would like to give, that when the vaccination level, especially in New South Wales, we've seen has started to go up in certain community or areas of significant risk, we started to see the infection numbers stabilize and the hospital admissions start to reduce. And that's another, and that's an example already we have in Australia in front of us.
Yeah, I think, Habib, you're right. There are mortality, I think, in initial stages in America and UK was high, and probably we were not that experienced last year when COVID hit, and we didn't know how to manage multicystic inflammatory syndrome, and many children died during that time. But in a more recent this year, the overall mortality rate has reduced down significantly, and luckily, as you can say, the Australian, we are a bit laid back as compared to America, but we are learning from American mistakes or from their experience too, and how best to manage our children. And because we are a little bit delayed in terms of the impact of pandemic on our children, and that's probably the reason the overall mortality rate in children, particularly in Australia, and I will talk more about the New South Wales, is less. So overall mortality is considered to be around 2 per million children infected with COVID. In fact, if we compare with influenza-induced mortality, it is slightly higher than the COVID-induced mortality in children. Do you agree, Dr. Habib?
Yes, no, thank you. I agree.
Just as a side note, I think I just heard a couple of reports from New South Wales, like even during the COVID time, COVID just do illness in children, mild illness, but at the same time, don't forget about other conditions too. I think we had a late presentation of pneumococcal illness in New South Wales. Even there was a that has got significant mortality and morbidity issues. There was, again, if you're worried, take help, call ambulance, as Habib said. But in generally, consider there are other conditions also just coexist at the same time. So just don't ignore other symptoms, putting everything into COVID. Just as a side note.
All right.
Raj,
Yeah,
I just
please
wanted
go
to add one piggyback a point from what Dr. Bhurawala just suggested about vaccination, that the vaccines are not 100% effective at preventing infection, but they substantially cut the risk of catching the COVID-19 infection. And by giving them to adults, we dramatically cut the risk of catching COVID-19 for children. And what we have found is the household or the close family contact from unvaccinated adult, they pose the greatest risk of spread to children.
Okay. So there is one question, live questions has come from the public, which is we all always appreciate, and we get so many questions coming in, and I would encourage people to ask live questions in your queries from this expert panel. So Dr. Kalpesh, I would like to ask the questions Neil has asked. When will vaccinations be available for kids younger than 12? And what is the most stable vaccinations for children?
I would have to possibly fall back on a recent press release from the Pfizer vaccine that at the moment they are trialing the vaccination for children aged between 5 years and 11 years with 1/3 of the dose that we are using for the adolescent and adult. And they are seeing a good amount of antibody responses in those children as well. At the moment, the data on the safety and efficacy and the risk for that particular group is being evaluated, and hence once the data comes out, the TGA, which is the Therapeutic Good Administration in Australia, and also the 𝐂𝐻AG, Australian Technical Advisory Group in immunization in Australia, will possibly review the data and definitely come out with the guidelines for children aged between 5 years and 11 years in terms of what vaccine is best, what is the dose to be used, and how many doses to be used as well.
Okay. So just moving forward from here, Lenina, can I ask you how many doses are generally recommended in children? What should be the adequate interval? It is more appropriate to get the best immunity.
Muted, Lenita.
Sorry, we can't hear you, Lenina. Hello. So maybe we'll come back to Lenina later. And can I shift the same questions to you, Ansar?
Yeah, the vaccine, as Kalpesh and Neil's question, that the current vaccine trial is almost mainly done by Pfizer and Moderna predominantly in US. They're also they've joined other countries like Finland, Spain, Poland, 3-4 multi-studies. And I understand that Novavax is also trialing in children. Those data of 5 to 11 is already the company has submitted to the approval agencies in US, Europe, and hopefully will be coming to ATAGI, like ATAGI and TGA also soon. As Kalpesh said, the dose they tried was 1/3 of the adult dose, and which has also showed the good response of immunity and antibody titer in that. They tried 2 doses. The time period was 28 days apart. Most of the vaccine, the concept is you give in 2 doses with a gap of between 3 to 6 weeks in between those two. So the trial is done with 4 weeks. And when it is out, depends on the number of COVID, availability, need of population. That is why we do see government making some variation or some change in the dose regime. But any dose between 3 to 6 weeks or even between 1 to 3 months is safe. 2 doses are normally studied with vaccine to boost immunity. 1 dose probably won't give you enough coverage. That is what we are seeing. Even the post-vaccine experience here also, those who had 2 doses in adults had much more mild illness than who received 1 dose, and who is some protection than who received no dose. So that is what the data, even post-hoc or post-marketing analysis, we have seen. Does that make sense?
Yep, absolutely. Thank you very much. And Habib, I will like you and Kalpesh both to answer one by one on this, because you gave a very good insight initially about the Delta virus, how common in children, and what are the symptoms coming and how do they present. And can we talk about when we know that the children are 98% of the children are generally having mild symptom or no symptoms, and they are generally very or ending up in a hospital is not that common. Do we really need to vaccinate these children? Habib, I'll start with you. Because
Sure.
always why I'm asking these questions, it may sound funny for medical professional that I'm asking these questions, but I'm being advocate of parents asking, because sitting in my private practice and always parent ask, you talk about say that this is very mild infection, then why do we need to vaccinate? Why can't we take it like a flu? What is the reason why I should vaccinate my child?
No, sure, definitely. What I might do is, I think this is very good question, and yes, I agree, because majority of the children don't get severe infections, and yes, this question might come in the mind. There are 2 ways. I think there are 2 ways to look at that. So one is that you look at the direct effect of vaccine, and you look at the indirect effect of vaccine. So direct benefits and indirect benefits. Now, direct benefits is that it does produces, antibodies. Your body is naturally trained to fight against COVID infection. So it stops you getting an infection in majority of the cases. And if it does get you infection, that would be much more milder than if you got an actual COVID infection without being vaccinated. So the same applies in children as well. We've also heard that multi-system inflammatory syndrome can be potentially very serious. What we also know is children are part of the family unit, and so if they do get infected and they are spreading infection, which is less likely than adult, still it can still affect the elderly members of the families or more vulnerable members of the family. Now we look at the benefits and risk of the vaccination. The side effects are very, very uncommon. And in fact, the studies both on Pfizer and Moderna, when it was part of a clinical trial, the efficacy is between 93 to 100%, and side effect profile is very, very safe. Well, absolutely, in terms of the benefit and risk, it's just so many more benefits. So there is certainly advantages of giving vaccine in that population. We also know that when we've vaccinated more adults, the more younger children are going to be left who are unvaccinated, because the virus is going to spread more in those who are unvaccinated. So we do not want them to get infection and then miss school, disruption to their schedule, and they've already missed out a lot in the education and school and socialization in last 18 months. We do not want any further disruption. It will also help reducing the school outbreaks potentially, because we also know from some learnings and data from, especially from North America and also from UK, the groups where there are more vaccinated children in some school districts, they had less school outbreaks compared to the groups where the vaccination rate in children is very low. So we're gonna eventually, return children to the school. We also don't want them to then have an outbreak, it closes again, and we're back into that cycle again. So I think there are lots of reasons I will describe why it is beneficial for also the children to get vaccinated. I hope I've answered some of the questions here.
Thank you. Yeah. Kalpesh, would you like to add anything more onto that?
I want to just emphasize about the the schooling. I mean, the fact that the more vaccination, the more population we get vaccinated, the better would be our herd immunity, and the better would be we would be able to get our children back to school again. And I just want to emphasize that point. I mean, at this point of time, the children are missing on the school education. They are missing on the peer-to-peer interactions. They are missing on the social interaction that they would have at the school as well. And this is, at this point of time, we don't know what would be the long-term impact of this missing of the school education and on their mental health. So at this point of time, it is best to get everybody vaccinated and get our children back into the school, which is what Dr. Bhurawala said already.
And just maybe an addition to that, we don't know what strains are coming next. So it is probably good to have its vaccination is basically exposing your body to a new type of virus which is circulating in the community, so that in case if you happen to come through, you are ready to fight against it. It's not like we are administering any specific immunity. It's just challenging our body so that the body knows how to fight it when it is encountering with a virus. So that is what we are trying to do with the vaccination. We don't know what variant is coming in future. It reduces the risk. Like if a lot of children are getting, then the number of like the multi-system disease, you may see more. So, and we don't know, the adolescents reports of chronic, like a long COVID, up to 10-15% is being reported from different places. So it is good to cover and better be them protected. And it is good for our community and society as a whole, as a unit.
Yeah. And that's where I would like to, Lenina, are you back? Can you hear me? Is Lenina, Dr. Lenina?
Yes, can you hear me?
You're
Yes,
breaking up.
Yes, can
Good.
you hear me?
Yes, fantastic. So I wanted to ask you in questions. First thing, we were talking about why children need to be vaccinated, and as a parent, we are always worried about, is vaccine safe for my child? So would you give us a little bit of idea? What's your view about the safety of vaccine in children, particularly the vaccine which is indicated, Pfizer and Moderna vaccine? Are you back? Did you hear the question? Should I repeat the question? Lenina. So maybe we'll come back to Lenina with these questions later on. But can I just bounce back to you, Dr. Habib, about, when we were talking about why children should be vaccinated. And at the same time, there are certain group of people who talk about ethical issues of vaccinations in children, why we should vaccinate to get the herd immunity, to make them a part of the herd immunity, when major part of the world does not have even 10-20% of vaccination rate, particularly in the developing or underdeveloped world. And where does the ethical issue stands here when we try to vaccinate our children?
Thank you. It is indeed a difficult situation. I must admit that there are several parts of the world who do not have the vaccine supply, and the vaccine equity is real. For example, when I've last looked at it, only 4% of African population, has been vaccinated, and it is also a risk everywhere, because then you might have more variants coming out. When we look at the Australian context, when you have a large majority of the population, and I must admit in New South Wales, we're touching 87% plus first dose. In certain areas, it's actually over 90%. So when you have all of that population, adult, has been vaccinated, we already committed in that, and then we are going to reopen. And then there will be some circulation of virus again. And it is very likely to circulate in, as I've mentioned again, in unvaccinated populations more than vaccinated, and that would predispose children. So I think in the society here in Australia, certainly that is a portion which is not covered, not protected. So even if they're not getting serious illness, they're still gonna get illness. They're still gonna miss school. They might get hospitalization or at home, and they still have some concern. So I must, say that there are ethical issues around that, and it is true that most of the developed countries or the rich countries have more vaccine supply than others. But when we look at the local context, that population being left unvaccinated can predispose. The data from US suggests that the states in which the vaccination rates are lower in children, like overall hospitalization of children, is higher. So the more vaccination of children, the less they are in the hospital. It's simple as that. Unvaccinated adolescents are 10 times more likely to be admitted in the hospital compared to vaccinated adolescents. And this is data from Center for Disease Control in US. They have a good registry of all the hospitalization due to COVID in different age groups, and that's what it's telling us at the moment. So I think there isn't enough information for us to suggest balancing risk and benefit and balancing ethical issues. Certainly there is enough for us to actually learn from those countries who started early why we should actually be looking at getting our children vaccinated, particularly vulnerable population. I know the questions keep coming around asthma, keep coming around others. That's where is again important that we want to just protect those children who are more at risk. And can I just say the last, and there is, I think, also a concern around what we are going to do about children who are under the age of 12. We don't have any vaccine for that group. How we are going to manage? How you're going to manage is what we call is a cocooning effect. So you're trying to protect those children under 12 who are still vulnerable. We don't have vaccine for them. We vaccinate all other people surrounding them and then offering a cocooning or a cushion. So teachers in the school, adults in the household, everybody else around in the community. Once you do that, I think you're less likely to predispose them to the virus, because there is no vaccine at the moment being approved for them as of now.
Okay. I mean, I will come to this. You very rightly raised this word of cocooning and cushioning, particularly for children less than 12 years of age. I'll get back to you and to the whole group with this about this more in detail. And let me take certain live questions has come up. And one of the questions by Gopi Kumar. So, are you firefighting with this vaccination? Is it better to wait for some medications to come out before we give vaccinations to children? Would you like to answer, Habib, please?
Sure. I think what we do know is there are certain medications are coming out and there are more in pipeline and we're getting some early results. What we do know though, if you compare the medications and compare the vaccination, the efficacy and effect is way, way better with the vaccination. It's 90% plus effective. Also, when you already have a COVID, and then you treat it, you're already infected. You might already have transmitted to others as well within the community. And still, there are a couple of medications which are, in the final stage approval or just been available. None of them has that 90 or 100% efficacy. Just in the media yesterday, there is one pill which might come out, has up to 50%, reduction in death rate, not 90%. We know that vaccine actually has between 90 to 100% reduction in absolute, hospitalization and death rate. So if you compare all the options we have available now, the vaccination seems to be the best option.
And just to clarify Gobi Umar's questions, we all know, just as going to the basics, corona is a virus. We don't have many other antivirals we do have antibiotics specifically for infection of different bacteria. So we are very unlikely to get something. Very few antivirals like acyclovir or other things are there, but we are unlikely to find some anti-corona specific medications. It is a viral illness. Your body is going to fight, and many people who are ending up in hospital is kind of a lot, mainly in adults, is kind of your body fighting back in a immune reaction or cytokine release or other mechanism, which is making them more sick, ARDS, blood clotting, myocarditis, all other things. These are actually secondary effect of your body fighting back. So kind of a immunities. And that's why we are treating with many other medications like steroids and other tocilizumab and other big medications, which is basically covering up that part. So we are not going to get an antiviral medication for corona. What we are treating is to reduce the severity of the illness which is happening secondary to that infection. And there are many medications are in use, many are in trial, so that will obviously reduce the morbidity and mortality which we are seeing. Even in Australia, the mortality is not high, though many youngsters and all other intensive supports are done. So I think that just for us, vaccination is to prevent getting it, prevent us going to the severe stage, prevent us getting into the hospital, prevent us getting into the ICU, and to prevent anybody who is dying. That is what all age group, and that is what we are also trying in children. And it is, if you don't control in the community, you can't, it is hard to be living in a social society.
Yeah. Thank you very much, Dr. Ansar. And next questions I would like to pick is from Shruti. What about asthma and COVID? How can we protect children with asthma, especially if vaccinations are not available for them? And can I ask Kalpesh, your input, please?
Is Dr. Habib answering that?
Well, Dr. Habib, would you like to answer?
Sure.
Yeah, I can answer that.
If the child has asthma.
Me, Raj?
Sorry, Lenina, you're breaking up. Habib, please go ahead.
So I think there are two parts to it. One is that I might just answer in two parts just for the clarity. I do not know what age that child has been discussed. I assume that is under 12, but I'll talk about both. So if the child is over 12, child has an asthma, yes, the recommendation is that you vaccinate those children, especially those who have other chronic medical condition. Now, also I would also mention that you would, for under age of 12, as I've described earlier, all other surrounding that child, if you vaccinate them, you're offering them a protection, indirect protection, cocooning effect. And again, that is the best way to protect them at the moment, and obviously you use other measures like use of mask, distancing, all other public health measures, hand hygiene and hand washing and others. So over 12, vaccinate children with asthma. That's the best way to protect them. Under 12, vaccinate everybody else surrounding them.
Yep.
Thank you.
And there is another question here regarding the hormonal effect of this vaccine. This was, let me just see, Harsha has asked this question. Any hormonal impact on children due to administering vaccination? Habib, would you like to answer this?
We've not seen any significant major effects so far. The vaccine has been, there has been around the millions of doses have been given, especially in America, and vaccine adverse effect reporting system keeps an eye on those, and they haven't seen major effects. There has been some reports around, especially in females, missing periods or having some irregularity in menstrual cycles. We've also seen that's also been shown in some other vaccines as well, and generally it gets settled. And while it's probably is a way the body is working against it, there were some questions raised, and I'll cover that, even if it's not clear as to which area male or female fertility is being referred to. There are a couple of parts of that. So one is that for male fertility, there was a trial done in America where they've looked at the sperm counts before and after COVID vaccination. It was done, I think, in Miami. They didn't find any significant difference in both groups. What they found, the same group actually also looked at some autopsy findings in 6 men who died because of COVID, and they found virus and some effect in the testicles. In one, a severe effect, and other 3, it was still found. And it's also shown that other viral infections also, that it can reach to the testicles as well. So I think what it's telling us, based on the data we have available so far, that COVID is more likely to affect your hormone systems. And if, say, especially for young people or children, if you had a severe illness or multi-system inflammatory, is more likely to also affect your hormonal system and your fertility potentially. So you probably would be, I think, overall it appears safe so far, what we know. And there has been a lot of data from during the trial and after the trial for both Pfizer and Moderna vaccines. Many women during those trials who had those vaccines became pregnant and have had babies. And there have been trials also of these vaccines when they've gone through the in vitro fertilization treatment, IVF we call it.
IVF.
And they also showed that those groups who had vaccine and who didn't have vaccine, it didn't show any significant difference in the IVF success rate. So I think there isn't enough information available for us to suggest at the moment that it appears to be no major concerns with a hormonal imbalance regards to the vaccination.
Okay. Thank you very much. And Ansar, just continuation to this one, we hear in news, we hear in people talking on social media, and which definitely scares many pregnant women and very young women, those who are, particularly if we talk about the late adolescent or youth group of 18 to 24, 25, with the highest fertility rate all over the world during this time. And they get worried about that vaccination affect the fertility. And do you think, is that myth or is there any reality in that?
So, yeah, I'm aware of such, and I have heard some people expressing that concern, but none of the scientific committee or experts doubting that it is an issue, and especially the vaccine like Moderna and Pfizer is been in the market for at least close to a year now. And even in countries like Israel and all, they started vaccinating even younger age group like 16, 17 from almost 16 to 18 from almost January. When I looked yesterday, Canada has done almost 78% of their 12 to 17 years got their first dose of vaccine, and almost 58% got the second dose. So all the major developing countries who have a very strong professional controlling body has evaluated, assessed, and they are independent scientists who have looked through all the evidences and all the concerns, and nobody has strongly raised this similar concern from the scientist point of view, especially related to fertility. And as Habib said, there have been occasions like in IVF context, many of the health staff who were got vaccinated early got pregnant. Some had even volunteered to get vaccination during pregnancy even before it get final, and they have showed that some degree of antibodies are passing to the baby. So there are so many strong evidences behind it is coming. It is we do have at least a clear data for more than 12 months, and we haven't seen such concerns. So my advice will be, listen to the experts, listen to the expert authorities, not only one countries, countries like USA, Canada, Australia, Israel, UK, Europe. They all have a very strong systematic process and scientific experts in all the bodies. If they think consider it is safe, I will be completely happy to take it without even 1% doubt.
Yeah, thank you very much. And just coming back to Kalpesh, people always worried about, the possible side effect of vaccination and the safety profile. Definitely, Habib has told that it has been quite safe and it's very effective, 95% plus to 100% effectivity in children, and reducing severity of the illness, reducing hospitalization, and up to some extent, it also helps in reducing the spread of virus from child to child, from child to adult, or from adult to child too. So when we talk about the safety, particularly in children point of view, I'm talking about what are the possible side effect, common side effect we see, and which, or is there any side effect parents should be worried about?
Just want to emphasize about about the clinical trials and the real world data that we have, and what Dr. Ansar, Dr. Habib have emphasized enough here, that we have shown that the COVID-19 vaccines have been approved for adolescents are very, very safe. The side effects of the vaccines have been well documented. We have local side effects, which is basically inflammation or pain at the site of the injection, or systemic side effects, which is fever, fatigue, and headache. Now, if you have this kind of side effects, you can take the analgesics or the antipyretics, that is paracetamol or ibuprofen, if you develop this immediate side effects from the vaccine. Of course, I want to emphasize that we prophylactically, we don't advise anybody to use paracetamol or ibuprofen before going for the vaccine. That's the immediate side effect. There is one more. Some reports have suggested syncope, where you would be a bit dizzy and you might fall. So there have been some reports that some adolescents can have syncope as well. And what's the New South Wales Health, and I suppose all over Australia, what's happening is most of the adolescents who are getting vaccinated, they have been monitored for 15 to 30 minutes before they have been let out of the vaccination center to monitor for any syncope or any syncope related injury. Now, you have to understand that in Australia, there is an active vaccine safety surveillance system called as 𝐂𝐻SAFETY, which monitors vaccines adverse effect in a real-time data. And they give us data with regards to the age-specific data. We have data if you have child who is Aboriginal or Torres Strait Islander, we have data for that as well. Now, more importantly, there have been some reports of what we know about myocarditis and pericarditis as well, but there are only some reports. Myocarditis, basically inflammation of the heart muscle, and the pericarditis is the inflammation of the outer lining of the heart. And when you have both the condition, it is called as myopericarditis. What has been seen so far is that the incidence is known. For that matter, myocarditis and pericarditis is known to occur in some viral illness as well. So it is not that the vaccination is causing more incidence of myocarditis and pericarditis. There has been some incidence to say those children or adolescents who had Pfizer or Moderna had these inflammation of the heart muscle presenting as chest pain, dizziness, or heavy breathing. The heart beating very fast. Those kind of symptoms have been presented. But again, most of the symptoms, most of the children were monitored, and most of them required some hospital admission, but no treatment. Maximum treatment they received was anti-inflammatories like paracetamol and ibuprofen. They were monitored in the hospital for a few days, including monitoring of the ECG, monitoring of the heart biomarker like troponin, and of course monitoring of the blood pressures. And pretty much once the symptoms subsided, once all the markers were normal, they were sent home. I want to emphasize there have been no mortality from the vaccine-associated myocarditis or pericarditis for the moment.
Thank you very much, Dr. Kalpesh. It was very detailed description of the possible side effects and some of the rare side effect too. And I would like to add over here, and more recently, we have seen even in Victoria, once the vaccinations in adolescent has been commenced, and we are receiving quite high number of emergency call or even hospital admissions for children coming with chest pain. And that's where I would like to emphasize that all children, those who are presenting with chest pain or feeling like having a chest pain, as Dr. Kalpesh said, they are not because of the myocarditis or pericarditis vaccine induced. Because normally myocarditis, pericarditis can happen because of other viral infections like normal flu. But more commonly, it has increased incidence because what happening, these young adults, they go to online and read about myocarditis, pericarditis. They read about vaccine and vaccine-induced complication side effect, and that cause a lot of anxiety and cause a panic attack. And that caused a more of a what we call as a fictitious or panic attack-induced chest pain, and they end up in a hospital. So that's where parents need to be, understand that every chest pain is not a life-threatening. Every chest pain is not a complication of vaccine. And important thing is to calm the child down. And there are important certain signs and symptoms to look into. And if it is beyond that, and that's what I would like to talk. Lenina has joined us back. Lenina, can you hear me? Can you
Yes,
see?
I can. I can hear you guys.
Yeah, so I would like to, sorry we missed you in the major part over here, but I would like to have your valuable contribution here. Is there any red flags here when parents should think about bringing child to the doctor, either GP or to the emergency, or calling the ambulance after post-vaccinations? At what stage they should think about bringing the child to the hospital?
Usually, parents won't end up in bringing the children to hospital after vaccination. But if in case, the child is having excessive fever or unsettledness, or there is significant swelling or hematoma at the injection site, or after all, if a parent is concerned of anything, they could access emergency or into the virtual lines, which is available in each territory. They can call and ask help. But if the child is reduced feeding or unable to look after at home, of course, they can enter the emergency. But usually it's very, very rare.
Thank you very much. And Habib, I would like to ask you about, particularly if the child is presenting and coming to you as a parent and asking, oh my God, I'm having a chest pain. What parents should do, when they should start worrying about at that stage?
I think if the child is complaining of chest pain, and which is they really significantly concerned about, and if they have what are the other signs is that they might say that the heart is racing very fast or irregular heartbeat, feeling short of breath or breathless, not able to speak properly, or not conscious, or not answering questions properly. I mean, these are the signs which they should be concerned about. Usually it happens after vaccine. Again, I'll emphasize it's very uncommon, but it happens within day 1 to day 5. Generally within 24 to 48 hours after vaccination. So I think first few days they need to watch. Generally, I might just mention that after vaccination in children, adolescent, like over 12, they can just do their routine activities, and if they feel okay, they can just do what they usually do. There doesn't need to be any additional precautions or any, they need to lie down in the bed for 2 days or something. It's not needed. If they're feeling fatigued or tired or any of those symptoms, I think that's when they can have that checked out. And particularly if there is any signs of chest pain or shortness of breath, they should get a medical attention just to make sure that it is because of vaccine or other causes. And there is a tool, a protocol available now. Everybody knows what needs to be looked at, what test we need to do, how that needs to be managed. And there is quite a good guideline available in Australia, and everybody knows. So if you go to any emergency department or any of your GP and others, you will be able to get all the right, the test and assessment evaluation, so it's not been missed. And that's another reason why we haven't seen that significant severe outcomes after vaccination, because we've learned from what we need to look for, and we have good protocols in place to really manage a very small number of potential adverse effects with vaccination. So I think we're well placed to do that bit as well.
Thank you very much. As we are running out of time, it's going to be a quick question. We left only 3 minutes with us. It's going to be a quick one. School are going to open from next week. As a parent, I'm worried sending my child to school. Tell me your advice, how as a parent I can protect my child, particularly less than 12-year-old. They are not vaccinated. Your questions, as you said, Dr. Habib, cocooning or cushioning. I would like to start with Kalpesh. Quickly, 1 minute, please, because we are running short of time.
Yeah, I would send my daughter, who's 9-year-old, and I've got another daughter, 15-year-old, both of them to school for sure. And there has to be standard precautions that needs to be taken at the school. And I guess the governments are working on getting the guidelines out before the schools are started. And I know that in New South Wales, we are reopening the school a week before. Both my daughters are excited. And the most important thing is that all the staff, what I'm guessing the guidelines would include is all the staff who's attending the school has to be vaccinated before attending the school. So most of them should have either 1 dose or at least 2 doses or both doses of vaccination. Wearing masks as much as possible all the time by the students and the staff as well. I mean, we would encourage the child who is okay to wear the mask should wear the mask at every possible time while they are at the school. Safe distancing, like the seating spaces, education spaces, safe distances while they are on their break, while they are in the playground. We should keep the adults and parents off the school grounds and avoid large crowds at the school. So these are the few things. Now, I'm sure that there will be more guidelines coming out, but these are the things which will definitely, as Dr. Bhurawala said, will have good amount of cocooning effect on these children, especially for children who are less than 12 years of age. But again, just want to emphasize, I would send both of my daughters to the school for sure when they are ready to go.
Thank you, Kalpesh. Thank you. We are running out of time. Sorry. Lenina, any advice from your side for these parents, those who are sending their children to school?
Nothing major, as we do all usually to prevent infection in children, safe distancing, practicing hygiene, that's all needed. And all household to be vaccinated, and kids in the play area, recess area, not much adults, and the schools following the guidelines, that will be enough. Nothing major to worry about children, because less than 10-year-old are not getting much sick at all, and their susceptibility to infection is much less. But we just protecting them to reduce the severe complication in children who have lot of complex illnesses. So vaccinating every children, they protect each other from everyone. That's the main idea. So
thank you very much, Ansar.
As a parent, I won't worry sending child to school.
Thank you very much, Ansar. A short public message, only 20 seconds left for us. 10 seconds for you, 10 for Habib.
I echo the same with the Kalpesh and Lenina. I'll be sending my daughter to school as soon as it opens. But just an addition, one of the doctor who studied the outbreaks at the school, and they said the children-to-children transmission is less compared to adult to child or adult to adult. So that was much more reassuring for us to see that data.
Thank you very much, Ansar. Habib, last message for the public.
Yes, I would definitely be recommending and sending children to school. And as everybody else have said, if you vaccinate all the children, you are going to help and protect those vulnerable children within that group as well. So I think we've got a collective good in this. It's quite safe. The risk of sending children to the school is much less compared to the benefits of them attending school. They have missed out a lot in last 18 months. I'll repeat again, and we shouldn't really withhold all the joy and encouragement and all the enjoyment they get at the school, which they are entitled to. So we let them go, we do our bit, and let them learn and play at the school. So that's what I would suggest.
Thank you very much. Thank you, Dr. Habib. And thank you all the panelists for your valuable time on a weekend to help creating awareness in our community about COVID, vaccination, and impact of COVID on our children. So I'm pretty sure our parents would have learned a lot from you, and we will come back to next Saturday again with another topic. Thank you very much, and thanks a lot. Bye.
Thanks.
Thank you.
Thank you. It's been a pleasure.